Can you do a tummy tuck with a fat transfer to the buttock or Brazilian butt lift, also known as BBL? Yes, you can. I do it all the time. It's a technique that I've developed and specialized over the past several years. So how do you do it together? Why don't other people do it together? What are the pros? What are the cons? What are the risks? What are the benefits? Let's go over that together. So as you guys know, you do a tummy tuck when someone has excess skin, and usually when liposuction is not going to be enough, because when you liposuction someone with a lot of skin, what happens? They look botched, it looks deflated, they get lumps, bumps and divots and irregularities, they'll get fluid collection and blood collection. So the best way usually in someone with excess skin is to do a tummy tuck. Now, that same person oftentimes wants a bigger buttock. So some doctors will be like, well, let's just do all the lipo, come back to the tummy tuck later, and they don't want to do it together. Why not? I think because they really don't know how to do it. I think it can be done safely and effectively. So how does it work? So when I do a tummy tuck, how do I make it work? I do a special tummy tuck with liposuction. So when I do my tummy tuck, I liposuction everything from the breast fold down to the pubic area, the whole side. When you liposuction with the tummy tuck, you're harvesting fat. Then that skin that I'm going to remove during a tummy tuck, also called the flap, I defat it. So I liposuction the heck out of it and make it super thin, because that skin is going to be removed anyway. So when I'm doing a BBL with the tummy tuck, my BBL is usually better because I've harvested extra fat that I wouldn't have been able to do it if I hadn't done the tummy tuck, because otherwise I would have had to leave fat on that skin so it doesn't look weird. Because that skin's coming off, I can remove more fat from that skin. Now, the old school philosophy is don't liposuction with your tummy tuck. Why not? Those people say you're going to kill the skin, you're going to get skin death and necrosis. In my opinion, that is not true. In my opinion, those people are saying that because they don't know how to properly do a tummy tuck with liposuction. So when you properly do a tummy tuck with liposuction, you have to understand what blood vessels to leave alone. You have to understand when you're doing your dissection and raising the skin, where you do a lot of dissection, where you do less dissection. You have to understand how do you lipo, what size tube are you going to use when you're doing lipoing, and at what pressure are you going to lipo. When you're liposuctioning, there's suction in the tube that sucks the fat out, right? And that suction has a pressure measured in inches of mercury. So when you understand these small, minute details, that's when you create a wild success. So when I do a BBL with my tummy tuck, I can often do it more effectively, right? Because I've harvested more fat and I can totally transform the body. I'm not limited by worrying about what's going to happen to excess skin. Incision hip to hip. Remove the skin, new belly button, harvest all that amazing fat from that skin. Then we'll flip the patient over while they're asleep, lipo the back. Then I'll put the fat in the buttock. I have more fat. So when someone's sitting after a BBL, because with the tummy tuck, you're going to be able to sit right away. One of the challenges is when they sit right away, you lose more fat. So when I do a BBL without tummy tuck, you're not sitting for 3 weeks. However, when I do it with the tummy tuck, when I do it without, you're not sitting for 3 weeks. But when I do it with the tummy tuck, you can sit right away because I've harvested extra fat from that skin flap, so I've accommodated for loss. I've put the fat in a particular way in different planes safely to the best of my ability to accommodate for that pressure for sitting. Because of that, I can do a tummy tuck the same time as a BBL. Now when I do the surgery, I do use 2 drains. There's one in the middle of the crease for the backside, and there's one drain in the front for the tummy tuck. So, can you do a tummy tuck the same time as a BBL? The answer is yes. And I think oftentimes you can make it better than just doing lipo when that person is a candidate. You can't sit, you have to plan for the sitting, you have to accommodate for it. When you have a plan and you've thought about the recovery, the surgery, and you go forward in that manner, understanding what, why, and how, that's how you're going to get a wild success. Let's do it.